There are numerous ways to solve this inefficiency in the healthcare system. We should enact new laws that protect consumers from illegal activity. Consumers shouldn't be slighted by malpractice or even worse, being tied up in legal proceedings that result with malpractice suits. We should also blacklist doctors who make grave mistakes. We shouldn't allow doctors to continue their practice if their practice isn't fair to their people that consume their service. We should increase the number of lawsuits on behalf of maliciously injured victims as a deterrent. There should be harsher penalties for doctors who leave patients post-traumatically scarred or who do not deliver on contractual terms. The problem is solved because less people buy at a smaller price, which opens up for severely needy sick people to receive the top level of labor. This means that the people that get free health care that are in the market only because the market is free for them and are consuming it kind of on an unnecessary basis are cut out, and the people that really need it, the people with severe conditions that we'll get to later in the speech, really need health care. They end up getting all the health care that they need and do not show deficiencies in an inefficient healthcare system. One interesting thing that I found looking over this speech is just being provincial about my judgments. I would say that the best doctors are at UC San Diego in my metropolitan area. They have highlighted great cardiovascular doctors as well as pediatric doctors and radiation oncology doctors, as well as sports medicine and surgeons that are premier level and really do a great job in their practice. So I know if worst came to worst, those people that can cure me from any diseases are close by in the major American urban areas. But one thing I've really found interesting when I started looking about websites on this topic of healthcare inefficiencies is what they're doing in Southeast San Diego at San Diego Black Health Associates. And the mission of SDBHA is to enhance the health status of African Americans in San Diego County through advocacy, education outreach, and professional development. And I think they've done a really good job of tackling their issues with the resources that they do have. The goals of the organization is provide a forum to address issues and influencing the health of African Americans. So the organization seems very tied to diseases specific in the African American community, which they discuss. And they go on to state that the prominent diseases are hypertension, heart disease, cancer, drug addiction, low birth weight, for newborns and infant high mortality. And they say that SDBH is working for change. And one thing that I found on their website about that they were working for change is that they're walking for the health of it, which is a walk around a really scenic part of San Diego, kind of in their more distressed areas of San Diego, I would say, that have been harder hit by U.S. foreign drug policy even. And they're walking to cure the diseases, and I thought that was so interesting because like things like hypertension and drug addiction and heart disease, I feel are so easily alleviated. Those problems are so improved through exercise, so I really think they're doing a great job of tackling the problem with the resources that they do have. So that kind of seems like a leader for us all to follow.